Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey, listeners, it's Lindsay Smith-Rogers, producer of Public Health on Call. Thank you so much for joining us for this season of the podcast. Our last episode of 2023 will be on December 20th, and then we will return to kick off the next season, season 9, on January 3rd. But first, I want to mention one of our other projects, Expert Insights. From the same team that has brought you the Public Health on Call podcast, the Expert Insights newsletter covers the pressing public health topics you care about, with expert takes from our renowned faculty, staff, and students. Like the podcast, the newsletter covers trending public health news like gun violence, opioids, abortion access, health equity, climate change, and more. Expert Insights helps you make sense of outbreaks, breakthroughs, and everything in between. If you're not already, please consider subscribing to this twice-weekly resource. Visit publichealth.jhu.edu/subscribe or click the link in today's episode description and sign up today. Finally, some thank yous from this season of the podcast. A big thank you to our talented team of audio producers who spend hours editing every episode of this podcast. Thank you to all of our guests who lend their ideas and expertise to these topics. Thank you also to our intrepid team of interns, Nicole Germo, Hannah Bennett, and Caroline Wang. Finally, we'd also like to thank you, our listeners, for sharing your ideas and questions and for downloading this podcast nearly 12 million times. Please keep writing us at publichealthquestion@jhu.edu, and thank you for being part of this podcast. This is Lindsay Smith-Rogers. Today, I speak with Johns Hopkins environmental health scientist Natalie Exum about an outbreak of a microscopic parasite in Baltimore's water supply that occurred in late September of this year. We talk about what the presence of the parasite means for the larger water system and why it's critical to repair and replace aging infrastructure throughout the U.S. We also talk about what you should and shouldn't do if there's ever a boil water notice in your community. Also, just a note that this conversation was recorded in November, and since then, President Biden has proposed a new plan to remove all lead water pipes across the country, a move that Dr. Exum says is a bold and necessary step, but one with a challenging timeline that will require urgent action. Let's listen. Natalie Exum, welcome back to Public Health on Call. We're so happy to have you. So in late September in Baltimore, there were concerns about a microscopic parasite in the water supply. Can you tell us a little bit more about what's been going on?
Sure. So this microscopic parasite is a mouthful called Cryptosporidium. And Cryptosporidium is naturally occurring in lots of guts of animals and birds and humans. It's a diarrheal disease. It's an enteric pathogen, so you have about 7 days of diarrhea when you have it. Not fun, but it can come from a number of different sources. So we do treat for it in our drinking water treatment systems, and it has to be filtered out a lot of the times because one of the disinfectants that we use is chlorine, and it's highly tolerant to chlorine. So if you have chlorine in your drinking water system and Cryptosporidium gets into it, you're not going to be able to disinfect it and get it out.
So how did they find it?
Drinking Water Utility, Baltimore's Department of Public Works, was doing routine testing, was doing routine monitoring of its finished water sources. So here in Baltimore, it's a little bit different than in other cities. We have some open reservoirs that have finished water. So after the water has left the treatment plant, after the chlorine and the correct dose of the chlorine to hold back the mostly bacterial and viral microbes, that leaves the treatment plant and it goes into our pipes, but it needs to be stored, right? Because we need to be able to distribute it and put pressure in the system and have some backup storage. So our storage systems are open, and that means that birds can fly over or animals could get in or open to the air. So that's potentially a problem.
So I want to talk more about that, but before we do that, can you just tell us a little bit how this most recent Cryptosporidium finding sort of resulted?
Sure. So they found it in September, and it was at a very low level. And the health department and the Maryland Department of Health decided with the Department of Public Works that this was not going to require a boil water notice, but that the vulnerable populations should be taking more preventative measures. So your young kids, your elderly, if you're on chemotherapy treatments, if you have HIV, you really need to be making sure that you're either filtering it out, boiling it, or drinking bottled water. So it's a huge burden for those people. Now they're continuing to do more monitoring. They're doing more weekly monitoring. And the good news is that they are no longer continuing to find it. So the scientists among us are saying, maybe it was a bird or maybe it was something that just unfortunately got into the open, finished water.
So I was going to ask you, is this something that is specific to Baltimore or can it happen anywhere?
So in our regulated piped drinking water network, typically this is not a problem at all. And I'm going to take you on a little bit of a history lesson. In the biggest cryptosporidium outbreak we've had in the United States was in 1993, actually in Milwaukee, Wisconsin. Over 400,000 people got sick with not just a kind of a quick diarrheal disease. This is a long episode of diarrhea, and a number of people died. And what they realized is that we need to have better regulations to control for this parasite. So the Safe Drinking Water Act, which was passed in 1974, is one of our greatest pieces of environmental legislation that we have. In the late 90s, they made a new regulation under the Safe Drinking Water Act called the Long-Term Enhanced Surface Water Treatment Rule. It's a mouthful, but it's very important because it requires that if we do have some of this finished water that is out in the open, that you're either covering it or treating for it. Baltimore was found to need to be more in compliance with that rule and is now in the process of covering those reservoirs that we have. So the routine monitoring is part of that to make sure that we are not having any cryptosporidium in these waters in the meantime.
So, and this is not the first time that Baltimore has faced issues with its water supply. Are these things related?
So no, actually, these two, the recent cryptosporidium advisory from that happened just in this past September and October is actually not connected to the boil water advisory that we had in West Baltimore in September 2022. That occurrence, that boil water notice advisory happened because we had routine testing going on, which again is part of the Safe Drinking Water Act, where we monitor in our distribution network the water quality. And so we found an indicator microbe, so a microbe that indicates that there's potentially fecal contamination in the drinking water. We found that come up positive in 3 different co-located, so they were close together in one section of West Baltimore. And we realized, or rather the Public Health Department and the Department of Public Works just realized that there was a pump that had gone down, the system had depressurized. Potentially there was a way that some contamination had gotten into the finished drinking water in the pipes. And that boil water advisory impacted a lot of people, and the system was eventually put back online. They flushed the pipes. They got the chlorine back up. And, when you're dealing with a drinking water system where the pipes are over 100 years old, the average age of those pipes that they determined had caused the failure for that boil water notice, the average age of them was over 100 years old. So pipes that leak and pipes that break are a huge challenge to operate and maintain.
And if I recall correctly, that September 2022 E. coli outbreak was occurring in some pretty disenfranchised neighborhoods in Baltimore.
Yeah, and, we don't have the data to be able to say whether or not those neighborhoods are kind of chronically under-maintained. So, this is an area that we're actively looking into here at the Bloomberg School to try and understand. But, I hate to say it, but in our aging drinking water system in the United States, this is common. I wasn't surprised. I actually would say that these are our laws and regulations working because they were monitoring all these sites on a pretty frequent basis to be able to know, okay, we haven't had any exceedances in our E. coli cases, but we're seeing this in the water, so we're going to be preventative and let everyone know that we need to boil the water.
So from your perspective, of course, you're looking out for these things. You say you weren't surprised. But, a lot of people that are living in these areas might not know that these two things were not related. They might look at it and say they happened a year apart. All of a sudden, I'm having to potentially boil my water if I have some, if I'm immunocompromised or have some health issues going on. What would you say overall about the water system in Baltimore? Like, is this something that we can trust, as you said, because there's routine testing going on, or is this something that demands more attention?
Yeah, I have to say that we have some of the most wonderful drinking water here in Baltimore. We have a massive reservoir system with great raw water sources that are treated and distributed to 1.8 million people. And so we produce massive amounts of water here in Baltimore, and it always meets the Safe Drinking Water Act. And you can tell that from the reports that the utility puts out. It is an excellent drinking water source. So I would say trust your tap water, and also trust when your utility says, we're going to act on the side of caution, we're going to act on the side of prevention to say, do these things because the systems that are in place are beginning to flash yellow lights, right? And so we want to prevent any illness. And that's actually the system working, in my opinion. But at the same time, we have to acknowledge that we have an overall aging system, and we need to be investing in it and being more proactive and more preventative with the maintenance of that system, so we don't have to have a whole neighborhood need to boil their water for days and days and days.
So I do want to talk a little bit about that because, boil water notices are not unique to Baltimore, and we have a lot of listeners that live, all over the U.S. or maybe even all over the world. I want to talk about some specifics. So if you get a boil water notice, and, I noticed here in Baltimore that when this happened, there were emails that went out, there might have been text messages, there were a number of different ways that the health department and other agencies made sure that people in a community were aware that this was going on. Let me ask you a basic question. Can you brush your teeth? Can you wash your fruits and vegetables? What are the basic tenets here?
Yeah, we are at the School of Public Health, and we're going to be as preventative as possible. So what I would say is bottled water or boiled water that has been boiled and potentially cooled down to do your teeth brushing, obviously, filling your infant's bottles. If you're cooking pasta and you've got a rolling boil for more than a minute, you can use that for cooking your pasta. But if you're washing your salad and such, we just want to make sure that one small microbe is not going to get into those crevices and get you sick. So, you can shower and you can bathe your baby in that water, but, maybe give them a sponge bath because you don't want them to take that swig of that bath water that sometimes they do. And even for washing your dishes, make sure that your dishwasher gets that sanitization up to a high enough heat so that you don't have any potentially contaminated water that gets into your drinking glass.
So the big takeaway here is that for the most part in a city like Baltimore, the drinking water is safe. What about some other cities? What about some other places? How does this play out there?
Yeah. We all know the story of Jackson, Mississippi's, recent kind of cresting of that river, and it brought down the treatment plant. And at that point, it was, everyone across the city, there was no water across the city of over 100,000 people. And Jackson, Mississippi is a good example of before that happened, there were hundreds and hundreds of boil water notices just in that year, right? So when that system went down, that was no surprise to the residents. The residents weren't trusting their drinking water way before that happened. So this is a real problem for many, many people. A lot of small drinking water systems in rural Texas, I think, is a really good example that there are so many challenges, and these under-resourced smaller drinking water systems really struggle just to keep the water flowing, never mind to make sure that the water that's flowing through it potentially is free from many contaminants, not just microbes.
Can you talk about really quickly just what some of those other contaminants might be? Because we've been specifically talking about microbes here,
sure,
but there's other concerns.
There are metals concerns, there are chemical concerns. Pressurized drinking water is really important. Whenever you're struggling with any kind of breaks in your pipes, that depressurizes your system and makes your drinking water vulnerable to a lot of different things. Sometimes, I don't know if we could have this be a visual, you can take a cross-section of your pipe, and sometimes you see the insides of these pipes look terrible and rusty and all these things growing in them. Well, that stuff can slough off and get into the drinking water. So, there's issues with lead. Lead service lines right now is a big issue in our country that we need to have replaced. So those are metals concerns, but also chemical concerns. And now, the Safe Drinking Water Act does regulate for many of them. A lot of the contaminants that we're concerned about are getting in after they leave the plant. But the list is really long. I don't know if we can get into them all right here.
No, that's okay. We can go back to cryptosporidium.
Sure.
So this particular incident in Baltimore was resolved fairly quickly. And again, you said that's really thanks to the systems at play, right?
Yeah. And, I am regularly checking the DPW's website at the moment because now they're doing weekly testing. And, we just want to make sure that we continue to get zeros and zeros and zeros. So I say it's resolved and we're continuing to keep our eye on it to make sure that it's resolved. But yeah, it's sometimes these things last for longer and we have to be grateful that, we can trust our water and open our taps and believe it's not going to make us sick.
Well, thank you so much, Natalie, for coming back to Public Health on Call to talk to us about this. I know you can talk about water systems all day, but we'll leave it there. Thanks again.
Thanks, Lindsay. It's been fun.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.